Attention hospital HR in Canada. Are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Hi, and welcome to the Gritty Nurse Podcast, an unfiltered and unapologetic podcast which discusses health and healthcare. My name is Amie.
My name is Sarah.
And we are your hosts.
Don't forget to hit the subscribe button wherever you listen to podcasts, Google, Spotify, iTunes, or our YouTube page. Please rate and review us.
Make sure you get our book, The Wisdom of Nurses. There's no better gift than giving the wisdom of nurses to nurses during Nursing Week.
All right, so welcome back, everyone. Welcome back to the Gritty Nurse Podcast. This is an unfiltered discussion related to health and healthcare. My name is Sarah.
And my name is Amie.
And we are your podcast hosts. So we have an amazing guest today. I actually met her and we hung out on NurseCon. We've been following her content for a long time. So today we have Nurse Fern on, aka Emma Geiser. And she is actually the founder of Nurse Fern, a platform dedicated to helping nurses explore non-traditional and remote jobs through education, support, and community. She has a background in medical intensive care, emerge, and clinical documentation integrity nursing. Once an adrenaline junkie, she now enjoys working from home in her pajamas.
That is so dope. That is like the best intro ever.
Welcome to the podcast. We're so glad to have you.
Thank you. I'm excited to be here. I actually have sweatpants on right now too. Just full disclosure.
Sweats are a way of life.
That is actually amazing. So do you want to share a bit more about yourself? I know that you had mentioned you've worked in Emerge generally, but you've done quite a bit, it seems like, before you went into this whole remote and non-traditional space.
Yeah. So I am from California in the US, and I initially worked as a unit clerk in the emergency department before I ever went to nursing school. And I was like, this is where I want to come back to. It also helps like the strong familial background in emergency nursing. So I did revolt a little bit and try ICU as a new grad. I made it a year. I really liked it, but I just felt a pull back to ER. So I went back and I spent the most of my time as a clinical nurse in the emergency department. I was there for 5 years at one of the busiest hospitals in Southern California. I don't even know what the bed count is anymore, but it was like 60 plus beds in our ER. And then I moved to a smaller community access hospital and continued in the ER there. And I just was starting to feel this pull. I'm a little bit of a YOLO type person. Like if I start to feel like I need a change, I don't think about it much. I'm not one of those nurses that sits there and is like, I need a change. And then like 10 years later, they're still in the same spot.
Right. Yeah.
I left 2 weeks later, practically, is usually like what happens with me. And so I ended up switching into the non-bedside role at the community hospital into clinical documentation integrity. And that is actually the longest job I have ever held, which I realized the other day, and I'm like, that is impressive. It was like 7-ish years I stayed in that
wow.
department.
That is a long time.
I was really proud of myself when I realized that, especially since I do tend to like be like, I'm going to try something new. So yeah, that is the entirety of my background is critical care, ER, and then CDI, and then flowing into nurse entrepreneurship.
Yeah, maybe before we talk about your nursing entrepreneurship, I'm a
Yeah.
little bit interested in this whole CDI role because, like, I'm kind of wondering if it's like a quality improvement type of position. Can you tell us a little bit about that?
Yes, I try not to be biased, but it is the best remote role on the planet.
Okay.
Let's hear it then.
It's hard to get into. So I try and like hold back a little bit on my love for this job. But clinical documentation is the perfect mix for somebody who is introverted and wants to be behind the scenes, involved in quality, get involved with charting. It's basically
Right.
chart reviews on
Ah,
steroids.
yeah.
So you get into these, like you're in the H&Ps, you're in the ER documentation, you're hunting down what happened with the medics, you're looking at labs and you're like, okay, this is what they're saying. This is what
Right.
I'm seeing. Are they going to talk about it? Or do I need to ask a question? Like, hey,
Detective
I
work.
see these cultures. I see these antibiotics. Are you going to say what it is?
Right.
That's CDI. It's connecting and making sure that what's going on with the patient is documented so that it can flow into coding. And as we all know, coding and what is charted is what happened. So that flows
Right.
into quality, billing, budgets, everything. So it really is this impressive role where you get this whole world review of what's happening. And it's a little bit mind-blowing once you like get into it and really see what it affects. But then at the same time, the longer I stayed in CDI and the more I got into like evaluating these charts, I realized how much more I was learning about disease processes than
Right.
I had that view of as a emergency or an ICU nurse even. And I was like, if I ever go back to the bedside, I'm going to be even better for having stepped
Right.
away and taken this job.
No, that is so dope because it actually reminds me of a role that I was recently in. So I was a quality and patient safety specialist, except I mean, I guess during the pandemic, I did get to do some of it in my pajamas, but I think the roles seem very similar, except my role was looking at, essentially like looking at errors that happened, I think is like level 4, 5, and 6. So any harm that befell a patient, I would do that deep dive into the chart. But it sounds like you were looking at charts just like, oh, just overall, right? Just generally, or were you looking at
concurrent reviews?
That's wild.
That is,
but it's so
yeah.
interesting.
Yeah.
When you can get into these things, like you get a different perspective, and it really does
100%.
improve your critical thinking and skills.
No, I think that's like a role that we should have. I can't think of a role like that here in Canada that might be remote. Like, for example, all of our quality improvement roles most likely are associated with the hospital, staying like at a hospital. And but I think that would be like a perfect remote job for Canadians too. Like, I think that's such a dope role. I want to hear more about it another time. But let's talk about a little bit more about you. So you did mention that you've taken some entrepreneurial ventures. We know you. We know you as Nurse Fern, but your name is Emma. Who is Nurse Fern?
Oh my goodness! So Nurse Fern, you told me I was allowed to be explicit, so I
100%.
So as an ER nurse, Fern stands for fucking ER nurse.
No way.
No. Hold
I
on.
love it. I
Back
love
this
it.
up. Back this up. What is it? What does Fern stand for?
Fucking ER nurse.
Okay,
So
you
that's
told me
the
something
original
else when we
acronym.
first met. You told me it was first an ER nurse.
So I told you,
50
no, so the
version?
clean version. I've come up with clean versions, okay? So initially I wasn't doing, like this requires me to backtrack just a touch on the meaning of this name. But so there's the traditional Fern meaning, which I did not make up. That's something that like a lot of ER nurses have. They wear little fern pins.
That's
Similar
so
to the,
dope.
like similar to the wilted daisy, they've been banned in many places.
Okay.
What's the wilted daisy?
The wilted daisy is like an anti-daisy award. So you know the daisy award in the States, right?
Yes,
So
yeah, I've heard of the
there's
Daisy
actually a
Awards. Yeah.
nurse on NurseCon that created the wilted daisy award.
That's
And
amazing.
it's like this pin that's black and it's like a dying daisy. And you don't have to be like, you know, the best nurse in anything to get this wilted daisy award. It's
Oh my
like
God.
the
No, I love
opposite.
it. Oh, all right. Sorry, Emma, go back.
No worries. That's like it's tongue in cheek like that. Admin does not like it. But I initially, when I wasn't on the side, I was working as a freelance writer in personal finance. Working with nurses petrified me outside of the hospital because I know how I am as a nurse. I'm opinionated. I will tell you what's up. And I was terrified that if I went into a nursing related business that I wasn't going to be able to handle the heat.
Right.
So I stayed away from it for a little bit. So initially it was supposed to be like tongue in cheek, like, hey, I'm a nurse, ER, but also since I write personal finance, I was like, well, financially enlightened nurse. And then I already had like the domain, the brand, everything. So when things shifted, it was an easy one to just recreate the acronym. So,
Wow.
I mean, sometimes I get the community involved in it. So we have things like former ER nurse, financially enlightened remote nurse. There's been some other funny ones that have come out from it.
That's really, really cool, and such a good way to connect with a variety of different communities. So I definitely I think that name is amazing. I'm sure that many other nurses in the emergency department can completely relate to that name. And I think like what would be a good one for labor and delivery or for like maternity?
Oh, that's a good question.
We need to come up with an acronym now.
I know.
I feel like
You're kind of putting me on the
now.
spot
I feel
here.
like I'm getting FOMO now because you've got such a great name there.
Yeah, I
You have
mean,
a great name too, Gritty Nurse. I love that.
well, I was like thinking like, yeah, gritty could stand for something, but it's too long. I mean, you know what? We should come up with something for the next episode. Okay.
You've inspired us.
Anyone listening, help us come up with an acronym for what gritty stands for, and we'll come up with some fun ones as well. And we'll just kind of trade them back and forth.
Sounds good.
I like it. Or you can get a mascot. Like I think it's the hockey team in DC. Is that it? Gritty.
Yes.
Oh,
so that's so
yeah.
funny that you mentioned that. So like my son came home and he's just like, Mom, there's like a little guy that's out there that has a dance. Do you guys know the gritty dance? Like, do you do it too? And I'm like, what is he talking about? And yes, there is a mascot called the Gritty.
You just gave us an assignment. Challenge accepted. We're gonna have to learn this gritty dance and perform it on one of our episodes.
Oh God.
Too. Oh man, it's like the most unhinged mascot you've ever seen.
Well, then maybe that's perfect because I mean, we can be quite unhinged sometimes. So I mean, it's all good.
This is kind of bringing us back to our topic. I know we diverged a bit. So what you do is really amazing. I think just like helping nurses see what else is there in nursing. So it's very similar to what I do when I wear my other hat with the RN resume. So can you talk a little bit about why you chose to go this way and what drives you? Because I had to look at your website and you put down that your core values are adaptability, individuality, and fearlessness.
Yeah. And I believe very strongly in those core values. It's a little bit of the rebel archetype and the caregiver archetype there that in nursing, we very much are caregivers, but the rebel side of it is that we don't have to go the traditional path of staying in clinical, staying in the bedside.
Right.
Like, there are no rules to our profession. It's only the limits you put on yourself and potentially a few crusty coworkers that you listen to that never make the jump to leave and hold you back a little bit. But yeah, being able to move around and try new things. Like one of the things I always tell people when they're interested in a non-bedside role, not necessarily even remote, is that it's not a life sentence. If you're interested in it, try it, see what you think. You're definitely going to gain new skills and knowledge that will help you. And if you want, you can move on to something else or go back to where you were from. But if you have that inkling, go ahead and give it a shot, try it. And that's really the core of what I do and share at Nurse Fern. And I know you didn't ask me this, but it was totally accidental that this all started. And it's a TikTok video that made me switch what my content was and really go in this direction and lean into what nurses were asking me for. And that's when I started building a team and a community and sharing resources and moving forward with the job board.
Yeah, you know, that's actually is so wonderful to hear and very refreshing because I think we're of the same mindset in terms of, you know, nurses don't have to stay at the bedside because we get that all the time, you know. We've been told and forced that this is the path that you should take. And a lot of nurses feel, you know, very scared to kind of move out of the bedside, or even if they're in community, they're really used to trying to do the same thing. And we know from like that historical standpoint from in nursing that it's just like, you know, we're supposed to be handmaidens, we're supposed to be angels, we're supposed to be demure and follow this enlightened path. And it's just like, no, we don't have to do any of that. I've said time again, and I'm sure as you read the book, I think all of that is bullshit. Like, I think it's crazy for that, you know, we have to have a certain type of path. I think we should chart our own course, and that we should decide what we want to do, and whether that is, you know, in a traditional nursing role or a non-traditional nursing role, it still is nursing. So one of the things I'd like to ask you is, you know, a lot of times there are times where people say, you know what, if you're not at the bedside, you're not a nurse. What's your take on that?
I need to trademark not a real nurse, because at this point I'm going to make stickers to give to everybody, and we're just going to own this phrase.
Right.
Uh, a lot of times, and I encourage people who genuinely have a question for me, like, how do I address these people? Because I am crusty and sarcastic at this point. So if somebody comes to me and they're like, so you're not a real nurse anymore, I'm
Right.
like, my answer might not be very compassionate, depending on the day you hit me. But I always encourage nurses to just remember that it probably comes from a lack of understanding of our profession.
Right.
Most often, the "are you still a real nurse" is a genuine curiosity that comes from people who are not in the medical world. So their view of nurses is that we are at the bedside providing
Right.
care. So it's often like completely new information when they find out that we don't have to be at the bedside touching patients, that we can be behind a computer doing quality, that we can be doing, I mean, they might be familiar with home visits, but anything outside of that typical patient care is new info. So I kind of feel out the situation often and see like if they'd be like, if it's more of a curiosity thing. And otherwise, then I go back to my sarcastic response where I'm like, I'm a desk jockey, pencil pusher.
I think that's awesome. Yeah, because, you know, this question actually comes a lot from within nursing as well.
Yeah.
So I would like to say also, I've been asked more than once also the same
Yeah.
question. Are you still a nurse? Or like, where do you work? And if you don't work for someone or you don't provide direct care, it's almost like
You're
there's
not a
even
nurse
within the nursing
anymore.
profession, there's this divide between
Yeah.
like bedside versus non-bedside nurses. And I'm always saying like we're part of the same team. We're still trying to advance patient care. We're still trying to advocate for the profession. So why does it have to be so black and white? Like my goal really is just to keep nurses in nursing, because I hear from nurses all the time. They're like, I want to leave nursing. And I'm like, do you want to leave nursing altogether, or are you just not happy where you are currently working? Because that's two completely different things. And I think nurses just don't know what's out there, right? Besides what they've always known or what they see most other nurses doing.
Yeah.
Absolutely.
And I feel there's some shame attached to it, particularly when it's coming from another nurse. They're trying to almost make you feel shameful, like, well, you're, you know, you're not a nurse unless you're doing this, or, you know, that's not really nursing. And of course, there's so many different things that we can get into, like you've mentioned, just different roles. Like I would say, yes, it's a non-traditional role that I'm doing, but I'm still a nurse. I still have to pay my damn dues. Like
Yeah.
RX,
Yeah.
like I think in California, they're probably better than what they are here. We pay so much. It's just like, oh my God, it's ridiculous. But it's just like at the end of the day, I did the work. I put the time in. It doesn't matter where I go. At the end of the day, I'm still doing the work that's related to patients and families, and I'm still going to be a nurse. So I think, you know, we're going to shut a lot of people up, Emma. Don't worry.
Oh yeah, the identity is real though, even
100%.
personally shifting. Like, so you're fighting the outside perception, but also you have your own internal struggle usually when
100%.
you're transitioning.
Yeah, you're 100% right. I did struggle with, you know, especially when I'm asked, like, for example, I got an email recently where someone's like, so when was the last time you were full-time in a hospital? I'm like, why does that matter? Like, if I'm still doing nursing work, why do I have to answer that type of question?
Mhm.
And it kind of gets your back up, and it's like, oh,
Mhm.
you know, maybe I'm not as nursey as I should be. And it's like, yeah, again, here comes the, you know, insidious bullshit that
Mhm.
we're kind of taught to think about how a nurse should look like, and that's changing, and the landscape is changing, and I think we should be proud of that.
Yeah.
um
And even
so
just that question, like the last time I was full-time in a hospital, I still wasn't in patient care. I'd
Right.
moved on already. So
Right.
just all like breaking down all of that can be exhausting, but yeah, knowing when.
For sure, for sure. So, speaking of non-traditional roles and roles that nurses want to get into, what is the trend with remote nursing nowadays?
Oh, the trend is that it is extremely popular.
Yeah.
Yeah.
Not like very predictably, it's gotten more popular. When I first transitioned into like my non-bedside position and then remote, it still was very much seen as something that people who are nearing retirement moved into.
Oh.
Interesting.
And that is definitely not the current trend. Nurses of all experience levels are learning that bedside care isn't the only option, and they're getting interested in these other positions, and they are seeking them, going out there, applying. Unfortunately, that's coupled with just a general really bad corporate job market right now. So the competition is really high. So you've got low inventory, high demand and competition. I'm hoping it's going to turn around when just with the natural cycles with recruiting and corporations, but definitely that's a trend I'm seeing right now.
Yeah. And so when you started Nurse Fern, was that before the pandemic or was that kind of during when everything was happening?
Oh man. So initial, just like my freelance writing was before, but when I transitioned into talking about remote nursing, it was like right at the beginning.
Okay.
Probably, you know what? I totally forgot about this. You know, you prepare and then you forget these little mini stories. I launched the website like 2 weeks, like mid-February. So like right before everything just shut
Right,
down.
right.
Oh, okay. Interesting timing. Like, I remember the very first time I heard of someone working from home, not even a nurse, just anyone. I used to work in a clinic, and there was a person who booked OR time. Like, they booked outpatient OR procedures.
Oh yeah.
And this person worked from home, and she would call from her cottage. And I thought that was the coolest thing ever. Like, to this day, I don't know what she looks like. I just know her name and her voice. And we were just like dumbfounded. Like, how do you even do work from home? Like, I just imagine like all these piles of notebooks where she would keep track of the OR time, but nobody really knew her. She was just this like disembodied voice, like on that show on what's that show? The Big Bang Theory, you know the mom that's always like yelling, but you don't know what she looks like. It was like that, and now it's just become so much more mainstream and, like you said, so much more popular that it's just changed so much since the pandemic, really.
Yeah. And I think there's a shift. I mean, you've got the whole corporate battle because it is different than normal nursing jobs. Like nurses are used to applying and basically getting anything they apply for,
Yeah.
with units needing clinical nurses. And that's not the case with remote nursing jobs. There's high competition. There's usually fewer openings for this role. So you really have to be on it with your application stuff and your timing, all of that. And it's a huge mental shift with applications for nurses.
Attention hospital employees and retirees in Canada. Picture this: a benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan, a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more.
Back to our regularly scheduled programming. So I'm just kind of wondering, Emma, what advice do you have for a nurse wanting to get into remote work? Because I'm sure you get this question all the time. And also, what do you think are some pros and cons? Because it's not like remote nursing is like perfect all the time. So there are, ups and downs as well. Do you want to share a little bit about what you think?
Yeah, I'm going to start with the application stuff and then you remind me about the second half. I can't multitask like that.
Okay.
I'll start rambling and it'll just be like, woo. So for a nurse who's interested in non-bedside jobs, they often come over to us, and this is their first introduction. So I always recommend that nurses get familiar with the types of jobs that are out there and available. There's lots of websites that have good info. We have career guides on our website you can read through with interviews from nurses that do these positions. So you can get an idea for what you really are interested in, because that's going to help you focus your job search. An unfocused job search is just chaos and awful and going to burn you out more than the job you're currently in that you're trying to escape. So really dialing in what you're interested in, and then making sure your application materials are good. You know this as a resume writer also, like making sure that you have a resume that's targeted towards the job you want, which is different than a clinical job. And there's lots of resources out there. You have them, I have them, on updating your resume so that you are targeting these remote and non-bedside roles versus the clinical ones. And then also starting to apply, tracking your applications, like just slowly wade in really is what I recommend. Find out, like, be an information seeker, be a sponge, absorb it, get your stuff together and start applying and tracking. And then hopefully you're going to have some bites pretty early on. It doesn't always happen. Many nurses often have this 6 months to 12 months of job searching before they land a role or really get interviews, which can be really like dejecting if you don't know that's what you're in for with the corporate environment right now. So my next step is always to recommend that you do some interview prep, because you're going to want to be ready when you're surprised when you get a response from your application. So that's really what I recommend with nurses diving in. And the community portion of it is so important, like being in like a Facebook group or friends or something, somewhere where other nurses are also going through this, so you can learn about companies, get advice, have feedback with each other. That is really important, so you're not feeling alone on this search.
Okay, and what do you think are the best and worst parts from your perspective about remote working?
Oh, so there are pros and cons to every type of non-bedside job, which you can definitely suss out with conversations on online materials. But for the most part, the pros and cons of general remote work are the fact that you're leaving a very social environment that, even though we don't like the term family for work, like we often are extremely close with our nursing coworkers, and the other healthcare providers we work with. Like we see shit together. We are close. We're trauma bonded. And then you leave and you're at home and you're behind a computer. And then you start to realize that you're alone. You don't have somebody to like joke around with during downtime. You start to get a little caregiver regret, and like you miss, your mind tends to start to glorify the things that you miss about nursing. And it can be a very real period of time that it takes to transition out of clinical care, being home alone. And it's not for everybody, and that's totally okay. Like if you get into like a remote or not, like particularly a remote role and realize that being alone in your office is not what's for you, that's okay. But that was definitely the hardest and easiest part for me. I'm an introvert. I can sit alone at home all day long, but the caregiver regret is really what got me in the beginning. I felt like I was abandoning my unit. I felt like there were patients that I could have been hands-on caring for. But at the same time, I really enjoyed the job that I was learning and that I was in. So it was very much this push-pull relationship on remote nursing.
I'm so sorry.
That's okay.
I love the little coos.
And
like,
I think we really glorify the fun parts too. Like it is super flexible. You can, you know, in some cases you can make your own hours. You can do laundry on your break. You can grab a bite to eat. So I think everyone more or less knows the pros. So it's really good that you talked a little bit about the cons in terms of your personality and that you might be feeling some regret from leaving.
Yeah.
And I think one of the things that I have the hardest time with online, I mean, online forums in general are very hard to get the real vibe for, especially when you have keyboard warriors in there. But most often I see people seeing things like, you still have to work if you have a remote job. And I'm like, it's okay to want to find a job that has some time flexibility and allows you to do other things. And I don't think any nurse is looking at a remote job thinking that they're not actually going to have to work.
Right. Well, this has been super exciting to hear from someone else who is in this space. Do you have any last words you want to share before we wrap it up?
I'm going to offer some encouragement. I was lucky enough early in my nursing career to have nurses that were extremely supportive of my interests and training and mentoring me and making sure that I knew that like nursing is a continuum and you can move around and try new things, and supported me in those decisions. And as a nurse, you can switch jobs. You will always gain new skills, new worldview, and you might never go back to where you came from, but you're going to continue moving forward and gaining new insights and things that will make you a stronger nurse.
Absolutely. I couldn't agree more. I think that all of our careers have kind of taken twists and turns that we didn't expect. You know, if I had done what everyone told me to do in the beginning, graduated, did my time in med surge, stayed in the hospital, just moved up seniority, I don't know that that would have been enough for me. And I think that we have to get over this mentality that we're not helping people anymore if we're not at the bedside, because the truth is I think we're helping people on a bigger scale and we're doing more things, right? So it's not that you're not helping, you're just helping in a different way.
And I do really believe that the future of nursing, in terms of seeing more nurses in different areas of the workforce, I think remote nursing is a fine place for nurses to be. So I'm excited to see what more might come from it. And I think that like we need to have way more remote work out here in Canada as well.
Yeah.
I
So
couldn't agree more.
before we end the episode, do you want to tell people where they can find you?
Sure. The easiest place to find me is at my website, www.nursefern.com. We're also Nurse Fern on all social medias.
Well, that's easy.
Yeah,
I try to keep it easy.
I mean, we're kind of the same. You just go to grittynurse.com, and on all our socials, we're either Gritty Nurse or Gritty Nurse Podcast.
Yeah, I mean, just look for the logo and you'll find the right one.
Excellent. Well, thank you so much, Emma, for coming on to the Green Nurse podcast and listening to my baby coo and start screaming and crying, but also talking about remote nursing, because I think that, again, like I said, I think we're going to see more of this. And I think that it's actually important that nurses are seen in different spaces, non-traditional ones as well.
Absolutely. Thanks for tuning in, everyone.